The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
And so tonight we're going to go over what your prostate is, how it impacts your health. We'll go over what exactly BPH is and some treatment options available for you as you traverse this life with us. All right, so next, so we're going to go over first about what the prostate overview is. So what is the prostate? So on your slide there, you're going to see the bladder, and this is a man in cross-section as if you were looking at someone from the side view. So we see that the prostate is this walnut-sized gland that surrounds the urethra. And I like to say that it sits like a donut all the way around the urethra. So as the bladder is up top and the prostate's below, the bladder has to squeeze and push urine through the prostate as it comes out through the urethra that you see right there. Prostate's a gland of male sexual reproduction. It produces and helps to produce a certain volume of the semen that comes out during ejaculation. In our 20s, the prostate is about 20 grams in size, which is about the size of a walnut. It can grow to the size of an apricot by the time men are in their 40s, and sometimes folks are predisposed to very large growth, and we've seen prostates the size of a navel orange. There we go. So there's different conditions that can affect the male prostate. So we have on the far left-hand side of your screen there, the normal condition where the bladder sits, stores urine at socially appropriate times, hopefully. The bladder eliminates urine. It goes through the prostate and out through the urethra. Prostatitis is a condition you might have heard of. It's an inflammatory infectious prostate condition that causes a lot of irritative symptoms. BPH is what we're going to be going over a lot tonight, and then prostate cancer, which is carcinoma that can occur within the prostate itself. So let's go over exactly what BPH is. All right, so BPH, simply B is for benign, means it's non-cancerous. P is prostatic, meaning it comes from the prostate itself, so benign prostate cells. And the hyperplasia simply means that the prostate has enlarged, not just the cells getting larger, but an actual increase in the number of cells within the prostate. So you can imagine as if there was big immigration into your state and suddenly things are all sort of crowded and things are growing and it's tight and it's hard to get commerce done as there's traffic because there's so many extra cells. That's sort of what BPH is. Normally, again, your prostate's about an inch and a half in diameter, about, like again, the size of a walnut. And when the prostate enlarges, it makes it harder for the bladder to empty through. And so you get signs of things called bladder outlet obstruction, or BOO, as we sometimes like to refer to that, and can cause these LUTs, or lower urinary tract symptoms. All right, so does BPH mean I have prostate cancer? So in a nutshell, no. Right? If I have difficulty urinating, do I have prostate cancer? It's unlikely that that is the source, right? And so if you're tuning into this webinar because you have some lower urinary tract symptoms, we'll go over what those are here in a few moments, it does not mean you have prostate cancer. All right, so BPH is not prostate cancer. BPH does not become prostate cancer. It does not turn into or cause to give you prostate cancer. Now, can you have prostate cancer and BPH? The answer is yes. And so you can have both entities at the same time, but by and large, prostate cancer is an asymptomatic disease until it is advanced in stage. So if you're concerned about prostate cancer or having that, or if you feel like you're at risk, that's where PSA, or prostate-specific antigen, that's a blood test you can have done, can be done with your primary care physician or with your urologist, and that can help distinguish between prostate cancer and BPH. Now, of note, if you have a significantly enlarged prostate, that can also lead to higher levels of PSA. So it'll be up to you and your doctor to determine whether a biopsy is necessary to rule out prostate cancer versus benign enlargement. All right, so normal versus enlarged. So these are two great pictures right here. So as the prostate enlarges, right, that donut gets bigger and the hole of the donut gets smaller. And so what happens here is from the picture on the left to the right, the prostate's enlarging, it's getting taller, it's getting bigger around, it's choking off the bladder. Now, there are some people where, pardon the dogs, so sorry. There are some people where the prostate enlarges and there's very little symptomatology that occurs with that. And there are some people whose prostates are relatively small and they have tremendous symptoms. So the amount of enlargement doesn't have to correlate with the degree of your symptomatology. So don't feel bad or don't be discouraged if you have terrible symptoms in a small prostate. Those aren't necessarily correlating factors, but oftentimes they are. So what are these symptoms of BPH? So here listed are frequency of urination, sudden urge, weak urine flow, trouble stopping and starting, inability to urinate, and feelings that the bladders are not completely empty. So here's what happens. Prostate enlarges, causes resistance to the flow of urine. So what naturally happens? Your urine stream slows down. And everybody takes a step or two forward in the bathroom floor. They get a little bit closer to the toilet. Sometimes they'll put a hand on the wall and lean forward. The stream doesn't arc across the street like it did when we were a kid. So that's the slowness or the weakness of stream. Feelings like you need to strain or push to get going, or something that I don't see here, which is hesitancy, where it's time to go to the bathroom, but the urine might not come out until we kind of pause, relax, or push. Those are obstructive symptoms. Now, after a while, just like if you were lifting weights, your bicep will get thicker because your bicep is fighting resistance. With the resistance that comes from an enlarged prostate, the bladder muscle itself will get stronger. But that stronger bladder muscle isn't a happy bladder muscle. And that's where we have these other irritative symptoms that come into play, like urgency. When it's time to go to the bathroom, I got to go right now. I'm going to stop the meeting. I got to go. Frequency. I'm going to the bathroom more often during the day. Nocturia. I'm getting up at night. Those are things that are the irritative symptoms. And so obstructive, irritative categories, that's what we see with BPH. All right, can this affect quality of life? Of course, right? It kind of goes without saying that if I now have to go to the bathroom every hour and a half to 2 hours, if I'm getting up 3 or 4 times at night, this is definitely going to impact my quality of life. And so men who suffer from BPH, 95% of them will answer that on their quality of life score that they're unhappy or worse. Of the men with sexual problems, 50% will have associated sexual problems with their BPH. And over half of the men with BPH say that their symptoms have a significant impact on their ability to have a normal life. Not only you experiencing these symptoms, but your family members as well. And so if you're getting up 2 or 3 times at night, you're often stirring your spouse who might be asleep. I know of couples where they have started to sleep in separate beds because their urination symptoms are distracting from a good night's rest. You can imagine that if you have a busy job or you have a job where it's hard to get to the bathroom on time and you develop urgency, that can impact on your job performance and potentially your take-home pay as well. So who's susceptible for getting BPH? Well, if you're a man, it's you. So BPH is the most common prostate problem for men over the age of 50. By the age of 60, at least half of men. By the age of 85, 90% of men, or almost everybody, has some degree of BPH. In 2010, a survey conducted showed that 15 million men in the United States had lower urinary tract symptoms. There are things that can worsen this. Obesity, lack of exercise can increase the risk of BPH. And one thing that I'll have or that I'll encounter when I'm talking with patients is that they have these lower urinary tract symptoms. They experience them on a daily basis, but they accept them as a normal part of aging. Now, oftentimes they're wearing glasses like these. And so I'll ask them to give me their glasses and I'll say, okay, well, your decreasing vision is a normal part of aging, but you've chosen to wear glasses to make that better. Why don't you choose to do something about your BPH and increase your quality of life. Because I'll tell you that it's much easier to read with these things, and it's much easier to urinate with some of the things that we're going to talk about next. So how is an enlarged prostate diagnosed? Well, oftentimes patients self-refer or refer to us by their primary physicians because of their self-evaluation scores. There's something called the AUA Symptom Score Index, which is, or the IPSS score and a quality of life score. These are scientifically validated, statistically significant, reproducible scores that will tell us how bothered, how severe your symptoms are. Next can be with a physical exam. You might have a digital rectal exam, everyone's favorite, where your prostate is found to be larger than the average prostate. We also have urine flow testing, where, excuse me, a simple void or urination into a special meter can measure how quickly you're urinating, how effectively you're urinating. After that type of study is often an ultrasound to see if you're starting to retain urine, and maybe part of your frequency is that you're only emptying halfway. So if you only go halfway, you never all the way empty, then you don't get to appreciate the full capacity of your bladder. So here, let's go over some treatment options on what we can do to help with this. And so we're going to go over behavioral modifications, watchful waiting, first line, and surgical procedures. So watchful waiting, right? What is this? This is basically.
I'm sorry about that.
No, that's quite all right. You're fine. So I'm a military veteran, and watchful waiting, and the military terms for me would be suck it up. All right, you're just going to like deal with it. There are some behavioral modifications that can be done. If you're having to get up at night, then you might restrict your fluids 2 hours before bedtime. So there's nothing else to drink. And when you get up at night to pee, there's not another full glass of water before you go back to bed. We might look at bladder irritants, which are the good things in life. So caffeine, chocolate, alcohol, tobacco, spicy foods, nuts might start to eliminate these things. And so if you're bothered by a little urgency, maybe we say you can't have that cup of coffee or that hot tea in the morning. Lumped into this category may be some herbal supplementation, and not all herbs work, but some herbs do. And the only thing I would say about herbal supplementation at this time would be that I can't tell you what brand to go to or what concentration is best or what plant is best, because the FDA doesn't study herbs. But many people will turn to herbs before they turn to medications, and they'll consider this sort of in watchful waiting. So the mainstay here is that it doesn't require an anesthetic in order to do watchful waiting, and there's no implant, and obviously there's no surgical retreatment because we haven't done anything to you except giving you some good advice. So medication, right? There's two classes of medications to help with prostate enlargement and urination symptoms, and we'll go over those two classes. The first is an alpha blocker. And what does an alpha blocker do? So an alpha blocker helps to relax some of the smooth muscle fibers at the base of the bladder and within the prostate. This makes the prostate softer, relaxing, opening up more, less compression on the urethra, makes it easier for the urine to flow out. So those obstructive symptoms, the slow stream, the hesitancy, the feeling like you need to push or strain, the stopping and starting of urination, those will get better typically with alpha blockers. The irritative symptoms, urgency, frequency, and nocturia or getting up at night will get better, but again later down the road after the bladder muscle can relax. Most common alpha blocker on the market today is tamsulosin. Can be found through the MMD website here. The common side effects to an alpha blocker when you first start taking it, it can also relax some smooth muscle in the body as well. And so some people have a little bit of lightheadedness or dizziness when they first start taking it. So we'll often advise men, take it at night. You get up at night, sit on the edge of the bed for a moment before you pop up so you don't get dizzy and have to sit back down quickly. One of the other common side effects with alpha blockers is some sexual dysfunction in the form of retrograde ejaculation. And so what happens there is that about 10% of the men on Flomax will experience an orgasm, but it'll be a dry fire. So that semen will go backwards into the bladder instead of being expelled outward. It's not harmful for you or for your spouse, but it is a different experience, and some people find that less than satisfying, and they'll move on to another medication or another treatment option because of that. Second medication is a 5-alpha reductase inhibitor. This medication is called finasteride. It's a 5 milligram tablet taken at nighttime. Now, your body's testosterone fuels prostate. And so some people are very sensitive to this. So the testosterone they make causes prostate growth to really skyrocket. Now, finasteride does not block all testosterone, but it blocks the conversion of a specific form of testosterone that impacts the prostate. So taking finasteride can help shrink the prostate, reduce that resistance to the flow of urine, and aid in urination. Now, I tell folks the prostate did not get large overnight. It does not shrink overnight. And so the average duration of medication before you can really count on experiencing symptom relief is usually 4 to 6 months. So if you're having super severe symptoms and you want to be on medication in my practice, I would give you both medications, an alpha blocker and a 5-alpha reductase inhibitor at the same time, knowing that that dual medical therapy really won't be benefited until 4 to 6 months. So I'm not going to make you wait in order to start that secondary medication. Now, one of the positive side effects of finasteride is that the form of testosterone that it blocks is responsible for male pattern baldness. So taking finasteride can sometimes reverse male pattern baldness. But it will also, by shrinking the prostate, sometimes reduce your semen volume as well. All right, phosphodiesterase inhibitors. So this is the medication that's responsible that you would see commonly for erectile dysfunction. So Viagra, Levitra, and Cialis are the 3 medications. Now, Cialis is unique in that it has, or tadalafil is unique in that it has a long half-life. So taking low-dose tadalafil on a daily basis can build into your system and give you a therapeutic level all day long. Now, these medications, in addition to helping with erectile dysfunction, can also relax some muscles in the prostate and the bladder neck and help with effective urine flow. So for people that have both erectile dysfunction and BPH symptoms or lower urinary tract symptoms, can sometimes get relief of both by taking a daily Cialis, having both the benefit of spontaneous intercourse as well as ease of urination. Common side effects here are going to be some flushing, occasional back pain, some nasal congestion, on rare occasion blurred vision, sometimes some headache or heartburn. All right, so now we're going to move on into some minimally invasive techniques for prostate treatment. You'll sometimes hear these referred to as MIST procedures, M-I-S-T, minimally invasive surgical therapy. First, we're going to talk about here is Rezum water vapor therapy. And so you can see in this, so Rezum is a non-surgical in-office therapy designed to help reduce your BPH symptoms by using water, superheated water, so steam therapy basically, to shrink excess prostate tissue. Now, and I think we have a video to follow this that'll show, but what helps here is a small scope is passed into the urethra. Through that scope, a needle is put into the prostate, and over the course of a few seconds, some water, heated water vapor or steam goes into the prostate. That steam goes where it needs to go. It causes some cell death, and then the prostate tissue actually shrinks back and it regresses as that tissue is being eliminated through the steam treatment. After this procedure, you're able to return to normal activities with just a few days. Catheter use is very, very common after this procedure, so you tend to have a catheter at least for 3 days. If you're not able to urinate at all and you're in complete retention and have a catheter already, if you have a Rezum treatment, you may have your catheter for an extended period of time, up to a couple of months in rare cases. But this is a office-based procedure. And let's go to the next slide. I think we'll see a video here. All right, so obviously this is brought to us by Boston Scientific. Water vapor therapy, this is becoming very common. I do a lot of this in my personal practice. Showing here the scope going in, there's the needle inserting, steam being applied. Each of these treatments, it takes 9 seconds. The average patient receives 4 treatments as we're seeing here. Occasionally there'll be a treatment at the bladder neck if there's a high middle lobe. Now what this water vapor will do is kill those cells. It's going to take away the need for additional medication, and everybody's going to love it, obviously, with a blue thumbs up. And I think the shield means that it's approved by most insurance companies, and everyone loves it. All right, so with Rezum water vapor therapy, all right, it's well received by patients. 97% of folks having a Rezum procedure would recommend it to a friend. It does not require a general anesthetic, which is a huge selling point, especially for folks that have significant cardiac or pulmonary disease or at risk for general anesthetic, so it can be done in an office setting. There's no permanent implants, and so how good is it? How long is it going to last? All right, so all of the minimally invasive procedures are great, but they're not as good as the gold standard procedure, the TURP, that we'll talk about in a little bit, but there are side effects to the TURP that the missed procedures help to avoid. So retreatment rates with Rezum therapy, you'll see here 4.4% over the course of 4 years. As data accumulates, then we will see better numbers there as far as the length. And then one nice thing with Rezum therapy is it does preserve ejaculatory function. So from a sexual health standpoint, you can have your prostate treated, you can improve your lower urinary tract symptoms from that bladder outlet obstruction, and still maintain normal sexual ejaculation function. Next on the minimally invasive surgical techniques is the prosthetic lift. The prosthetic lift, again, is a non-surgical outpatient procedure. Sometimes this is done in an office setting. Sometimes it's done in a surgical suite with some moderate sedation. It does not require general anesthetic. There is a permanent implant here. This is where a sort of a tie back on a curtain is used. So if you can imagine an implant going in and pinching open the prostate and holding it open in a few locations. We have seen with this prosthetic lift procedure, the retreatment rate is higher than with a Rezum procedure, but some men will come in specifically asking for this, and it's not a bad procedure. Side effects are shown there. One of the unique side effects with the prosthetic lift is that because there is a permanent implant, we're relying upon the body to cover the implant with mucosa or with cells, like the lining of the inside of your mouth, the lining of the inside of the bladder. If that clip is exposed, then urine coming in contact with that clip will form stones, and occasionally people will come back for secondary treatments. And so you see the retreatment rate is a bit higher. Instead of 4.4%, we're looking closer to 14% for the prosthetic lift. All right, green light laser therapy. We're getting more now into the more invasive procedures here. And I say that there's a little misprint on this slide. The green light laser therapy does require general anesthetic, but there is no permanent implant. All right, so those yes and no's need to be reversed. In this type of a procedure, a telescope is placed into the prostate, and a laser fiber is put in, and the laser vaporizes the enlarged prostate tissue. There is excellent hemostasis with this procedure. Can often be done as an outpatient, but as far as general anesthesia goes, I can tell you would not like me very much if I put a laser in your prostate and went to town. I would usually get like a footprint right about here, so we sort of avoid that. The procedure often can be done without a catheter, but some people do maintain a catheter depending on the particulars of their situation. All right, the transurethral resection of prostate, or the TURP for short, the TURP, is sort of our gold standard telescope procedure for prostate tissue. This procedure has been done for men for the last probably 85 years, if not longer. This does require general anesthetic. There is no implant used. In this case, an electric loop goes in, and very much like a garden hoe, the loop goes out, it resects tissue back, and there's a little chip that floats off into the bladder, so you're physically removing the tissue real time. Unlike the Rezum, where you're putting superheated water in, you're allowing that tissue to die and then regress, and the body absorbs that tissue. This, you're physically removing tissue. With the Rezum procedure, the bladder neck is preserved, in a TURP procedure or a green light procedure, the bladder neck is opened as a part of the procedure. That's going to result in that retrograde ejaculation. So although it's a more definitive procedure, there are some trade-offs that go with this. TURPs will, I would say, probably 25 to 30% of the time spend the night in the hospital, depending on the size of the TURP and other factors. Now, for the gentleman that has really exceeded all expectations and grown a really big prostate, and so now we're talking prostate sizes of in excess of 100 to 200 grams, whereas average enlargement would be about 40 grams and normal prostate would be about 20 grams. So for people with the very big prostates, the prostate itself can be enucleated, right? What I mean by that is you can imagine an apple or an orange, and you are going to go in and core out the entire center of the fleshy fruit of that organ and then leave the capsule in place. This is called a simple prostatectomy. This should not be confused with a radical prostatectomy, which is a cancer operation. All right, so completely different operation. Divorce the two in your mind. So simple prostatectomy, general anesthetic, no implants. Large volumes of tissue are removed in one setting. Depending on the technique, if it's done open versus robotically, there can be some considerable blood loss. So it's not uncommon for someone to have a transfusion if they're having an open simple prostatectomy. Less likely with a robotics prostatectomy. And again, retrograde ejaculation is going to be pretty much assured in this type of procedure. But fortunately, men often don't get to this point. But if you are in this situation, it's a great procedure to bring you back to urinating normally. Insurance coverage, obviously, nothing in this world is free. It's a responsibility of you to contact your personal payer to see what they're going to cover there. All right, so in summary, prostate is an organ that sits like a donut around the urethra. As you age, the prostate enlarges. It also chokes off the urethra. It's going to make the bladder have to work harder. So as your urine stream slows, as you become feel like you need to push, there's some dribbling afterwards. It's starting and stopping. It doesn't want to start right away. Your bladder gets stronger to help you out. That results in urgency, frequency, and getting up at night or nocturia. BPH is a benign condition. It's not cancer. Cancer doesn't have symptoms in the prostate, so you're going to get PSA testing for cancer screening separate from BPH. You can do some behavioral modifications, try some herbal supplements if that's in your wheelhouse. We can look at medical therapy. We can look at minimally invasive surgical techniques like the Resume procedure or the prosthetic implant procedure, some other procedures on the horizon. Surgical procedures, laser therapy for the prostate, green light, and even holmium, TURP procedure or prostatectomy. There's some other technologies that are also available that I'm not covering here tonight. But this is something that, this is a condition that's very treatable. You don't have to live with these symptoms, and you don't have to incur any real long-term side effects depending on what you choose. There is a Resume reimbursement hotline. Since this talk is help sponsored by Boston Scientific, you'll see the numbers on your screen there that'll help determine eligibility and pre-authorization. All right, so next step. So what do you do? All right, you contact your primary care, you contact your local urologist, depending on how you can get into that specialist. Sit down, have a conversation, go through the evaluation, and determine what's best for you.
I'm going to start off with some general BPH questions here, enlarged prostate questions. So first question tonight is, what is a normal PSA, and when should you do a biopsy to check for possible cancer? Mine is now 12.
So that's a nuanced question, but I will give you some things in general. So if you look at all comers, we use 4 to 4.5 as a cutoff for an elevated PSA. As you get older, and so over the age of 70, depending on what guideline you look at, there could be additional screening that's recommended or less screening that's recommended above the age of 70. So assuming that you're under 70 years of age with a PSA of 12, in my practice, that would I would recommend that you have a biopsy to rule out prostate cancer before we go and treat any additional symptoms. The younger you are, the less PSA we like you to have. So you can also look at age-specific reference ranges, but a simple good rule of thumb is 4 to 4.5 at the age of 70. So PSA of 12 definitely requires further investigation to make sure there's not something serious going on. So I encourage you to see your urologist for that PSA.
Alrighty. Next question here. At what age should men start getting checked for BPH? My father was diagnosed at age 52. I am now 36 and wondering if I should start getting checked myself.
So getting checked for BPH, different than being screened for prostate cancer, just like getting screened for colon cancer. So BPH is going to be a symptomatology type process. So as you approach the age that your father was, if you're noticing those symptom scores are increasing, and the IPSS score and the AUA symptom score are readily available online, you can just search for that. You can fill out that symptom score and you can follow yourself along. So, okay, I did one this year. Next year, I'm going to do another. Let me see how my score changes. And if you're noticing an increase in your scores, or you're just in general noticing a bother, that would be the time to go get checked out.
Alrighty. Next question here. So this question is asking what tools do you use to diagnose and monitor the progression of BPH symptoms?
So the simplest tool that we use is that symptom score. So that is a statistically validated symptom score, and we can monitor your progress on that as a response to medication or just over time. The second thing that we can do is a non-invasive urine flow study. At that point, you would come into the clinic with a relatively full bladder. You would eliminate or urinate into a machine. It would give us a graphic representation of your urine flow, followed by a non-invasive ultrasound to assess your emptying status. So for some folks we follow this along and we see that their residual urine starts to increase, so they're not emptying their bladders completely, and that could be a sign to them that they're ready to get something done. There is a more invasive urodynamic testing that can give us some really true numbers on the amount of pressure your bladder is generating, but those are typically done when people aren't responding to normal treatments.
Alrighty. Next question here. Can an enlarged prostate be caused by Agent Orange exposure?
So Agent Orange is not implicated in prostate enlargement. The Veterans Affairs official position on Agent Orange and prostate cancer is it can neither confirm nor deny that Agent Orange is implicated in the development of prostate cancer. So as a default, it will acknowledge Agent Orange as a potential causative factor. There's studies, both pros and cons, that show it either way, but the VA defaults as to saying that the cancer issue, they will recognize it. But as far as overall enlargement, that has not been an associated factor with Agent Orange.
Alrighty. Next question here, a bit of a review, but is it common to control an enlarged prostate with supplements?
So there's a lot of supplements on the market. The most common supplement that I see to be effective contains some degree of saw palmetto. That will control symptoms, but not enlargement. There have been on the market in the past supplements containing compounds called phytoestrogens, which are plant-based estrogens that can decrease the actual size of the prostate. These have been discouraged in use because they have resulted in the development of blood clots. And so if you have a supplement that you're considering taking and you're not really sure of the ingredients, I would just ask your primary physician or urologist if they feel that's something safe to take.
Alrighty. Next question here. Does an enlarged prostate lead to sexual health problems like erectile dysfunction or premature ejaculation?
So premature ejaculation is not related at all to an increased prostate. And there are some very specific treatments that can help with that. That is a condition of arousal and nerve function. There are other medications that can predispose someone to that sort of a thing, or other conditions. An enlarged prostate, depending on the etiology of that, can have associated factors that would contribute to erectile dysfunction. So we have noted that people with inactive lifestyles, patients with obesity, are predisposed to both erectile dysfunction as well as enlarged prostate. And then we had gone over some of the medications may contribute to erectile dysfunction when your prostate is being treated for that. And so from an erectile dysfunction or sexual dysfunction standpoint, erectile dysfunction, BPH associated, premature ejaculation, not as much.
Alrighty. Next question here. Can you use injection therapy at the same time you use medication to lower your enlarged prostate?
I'm assuming that by injection therapy, they're talking about injection therapy for erectile dysfunction, and absolutely. So I have many patients that are on injection therapy for erectile dysfunction at the same time taking medication or undergoing procedures for their BPH, and those are can be done in conjunction with each other without any issues whatsoever.
Alrighty, next question here. What is the best medication to use for BPH that won't interfere with erections?
So the alpha blockers tend not to interfere with erections. Sometimes the 5-alpha reductase inhibitors do, but both categories can. So it really kind of depends on your current situation. Now, there are about 5 or 6 different alpha blockers on the market, and not all of them have the exact same side effect profile. So if you take one alpha blocker and it's causing some issues, you could take a different one and see if it causes the same issues without any harm. There's only 2 forms of the 5-alpha reductase inhibitors on the market, so it's either one or the other, and they really work pretty much exactly the same. So I would expect if you had the issue with one, you would the other. If erectile dysfunction and BPH is an issue, many insurance companies will cover daily use tadalafil, which would sort of kill 2 birds with 1 stone. You'd have better urination, better erections, and call it a day. Call it a win.
Alrighty. Next question here, a bit of a follow-up. Once an enlarged prostate is treated with medications for BPH or enlarged prostate, will the symptoms or the enlarged prostate come back once the medications are discontinued?
All right, so alpha blocker medications work quickly as the prostate, but it doesn't prevent prostate enlargement. It relaxes the muscles, but it doesn't keep the prostate from getting bigger. So I'll have many patients tell me, I've been on my alpha blocker, but now I find that if I miss a day or two, I almost can't urinate. And they become very dependent on the medication because their prostate continues to enlarge despite the medication. Now with the 5-alpha reductase inhibitor, it will help to decrease the size of the prostate and can help prevent future enlargement as long as you're taking it. Again, that's a medication that takes 4 to 6 months to work. If you were to come off of it, you wouldn't really notice a difference immediately. It'd probably take another 4 to 6 months for you to start to have enlargement again and start to realize some symptoms. I do have people that are both on the alpha blocker and the 5-alpha reductase inhibitor. They'll be on that combination for about a year or so. We can stop the alpha blocker and still maintain their symptom control because their prostate has shrunk down in size. But if they stop both medications, then their symptoms recur.
Alrighty. Another question here about combining treatments. This person wants to know if they can use testosterone gel, if this will affect their enlarged prostate.
So there's a certain threshold above which the prostate will begin to be stimulated by the excess testosterone that you're taking. So depending on the clinic that you're getting your testosterone from, they may set different standards for success. So the American Urologic Association has set some clear guidelines on what the upper limits of normal for testosterone should be. Yet some male aging clinics will push that envelope and get testosterone levels up to a puberty type level in a quote anti-aging quote process. The more testosterone you're taking, sometimes, and it depends on the individual, their prostate will continue to enlarge. So people on testosterone replacement therapy in my practice receive PSA testing as well as other lab testing to make sure that they are maintaining a safe, healthy lifestyle along with their testosterone supplementation. So, I mean, yes and no. If you take extra testosterone, can it make your prostate grow? Yes. If your testosterone level is completely in the toilet, and we're talking about levels close to castration, your prostate will actually shrink, but you're not going to feel good either. So it's a complicated subject, but I hope that helps.
Alrighty. Next question here. This person says they're presently on finasteride, but are wondering if there is something without a side effects like enlarged breasts.
So that is a side effect that we did not cover. So there are two medications in that category, finasteride and Avodart, and both medications have the exact same mechanism of action. So by denying the body of dihydroxytestosterone, hair can grow back, but the estrogens that the male body naturally produces are no longer opposed. That can result in breast enlargement. Stopping the finasteride will not make the breast enlargement go away. So once that enlargement is present, then the only remedy for that is going to be, and that condition is called gynecomastia. The only remedy for that is going to be surgical excision of that excess breast tissue through plastic surgery. Once, if I have somebody on finasteride that begins to experience any kind of tenderness under the nipple at all, we tend to stop that medication right away in order to keep gynecomastia from developing and recommend other forms of treatment for their BPH.
Alrighty. Next question here. Saw this one a couple of times. People are looking for treatments for retrograde ejaculation, I guess following BPH procedures such as an implant.
Such as an implant for the BPH or an implant for erections?
Sorry, yeah, an implant for erections, but following, a radical prostatectomy is what I meant to say.
Oh, okay. All right. Different terms here. Retrograde ejaculation is when you produce ejaculate and it goes backwards into the bladder. So if I'm going to be on a medication like Flomax, I might ejaculate, but it goes backwards. I'm still producing semen, but it just doesn't come out. If I was on Flomax and I had retrograde ejaculation, I might take a different alpha blocker and have antegrade or forward ejaculation. When you have undergone a radical prostatectomy for prostate cancer surgery, you no longer have the organs that produce semen, and you no longer have retrograde ejaculation. You have anejaculation because your ejaculatory organs have been removed. So there is no treatment for a lack of ejaculation secondary to prostate cancer treatment because you no longer have the organ that produces that seminal volume. If you have had a BPH procedure like a TURP and you have retrograde ejaculation, occasionally the use of something to tighten the bladder neck like pseudoephedrine can help with forward flow of semen. But again, after a prostatectomy for cancer, there is no more ejaculation.
Alrighty. Thank you for clarifying that question there. So next question here, this person wants to know some of the advantages and disadvantages of the UroLift for those with a very large prostate.
So with both UroLift and Resume procedures, the FDA has listed some very specific volumes, usually 70 to 80 grams, for the indication of those procedures. So for prostates larger than that, you may find that your provider discourages that, or your insurance company may not authorize the procedure because it's not FDA indicated. Now, in certain situations, people have still had UroLift or Resume procedures for very enlarged prostates who were at super high risk for going to the operating room for something more definitive. Those procedures have varying degrees of success, but limited studies are on that as to, which is why the FDA hasn't indicated higher sizes. So, in a discussion with you and your provider, it could be that it's worth a shot for you or not, depending on that conversation you have with your provider.
Alrighty. Another UroLift question here. This person wants to know if the UroLift can be completed with local anesthesia, and if so, how local is the anesthesia obtained? They're also wondering about the pain and the procedure while under the anesthesia.
All right. So with both UroLift and Resume, the anesthetic or the local is applied as follows. So you would first start with a transrectal ultrasound. So ultrasound in the backside, visualizing the prostate, the same as we would visualize the prostate for a prostate biopsy. Through that rectal ultrasound, numbing medicine is applied to the prostate gland and allowed to sit for up to 20 minutes. After that procedure is done, you typically would move to a separate room where a telescope would then go in through the penis to be able to apply either the Resume or the UroLift. Your doctor may give you either an oral medication, something like Ativan or Valium to help relax you. They may give you some nitric oxide to breathe in the form of something called Pronox, or they may give you some old-fashioned okay anesthesia and just tell you it's going to be okay while they do their procedure. But that's how that would work.
Alrighty. Next question here. With Resume therapy, how soon can I expect to see improvements in my symptoms?
So with this Resume therapy, and let's talk about, first of all, just the guy that has some lower urinary tract symptoms. They're not in retention. They're voiding, fair because they're having a Resume done. You have your procedure. You have a catheter in place for 3 days. Catheter is removed. You continue on any medication that you're currently taking. And for the first 2 weeks after the Resume therapy is a little bit of a rough period because as that steam goes in there, that tissue kind of swells with that inflammatory response. And as that inflammation dies away and the tissue regresses and the curtain is pulled back, that's when you start to get some relief of symptoms. So I would say about 2 weeks afterwards, things start really getting better. By a month, I typically have patients stop medications. By 3 months, they feel like they're a new man.
Alrighty. Next question here is the Resume treatment as effective as the green light laser therapy treatment?
So two different treatments there. The benefit of the Resume of the green light or any other laser procedure is that you're more likely to retain your ejaculatory function with Resume than with a laser procedure because of how it's going to affect the bladder neck. As far as relief of symptoms, symptom scores are a little better with the green light laser, but you're also destroying or eliminating more tissue with the green light than you would be with the Resume. Green light's going to require anesthetic, Resume is not. Retreatment rates, at least in the 5-year period of time, are similar. I could see where green light would have potentially a more durable response because you're really eliminating a lot of tissue with that. But at the same time, if you have a Resume now and in 10 years you need a green light, well, you've had 10 years of normal sexual function that you wouldn't have had with the green light.
Alrighty. Next question here. Do you have to go to the hospital for the Resume treatment? And does the Resume treatment affect your erections?
So Resume treatment does not affect the erections, and you do not have to go to the hospital. Now, some of that is dependent upon your provider, how comfortable they are, and what sort of setup they have in their office. But most providers today are able to perform the Resume in an office setting with you returning to work the next day. Or if you had it on a Friday, catheter for 3 days, catheter's out, you go back to work Monday. Depending on what kind of job you do, you might want to take a couple of days off.
Alrighty. We're going to move on to some frequent urination questions here. So this first question, this person would like to know what they can do about frequent urination at night.
So multifactorial goes there. All right, so 1, 2 hours before bedtime, fluid restrictions. Monitor the amount of alcohol you're having in the evening. Try to eliminate it. If you have caffeine, switch to decaf, especially in the evening. If you have obstructive sleep apnea, wear your CPAP. If you don't go into a deep REM sleep, your body doesn't produce a natural hormone called vasopressin. which will slow down urine production at night. If you have swelling in the legs, swelling in the ankles, try to elevate your feet above your heart before you go to bed. So if you're watching the evening news or television program, keep your feet up, get that fluid back into circulation before you go to bed so you have a chance to eliminate that. Compression stocking use during the day can help with that as well. There's just a lot that goes into that, but by and large, fluid restriction, feet elevated, wear your CPAP, avoid caffeine or alcohol before bed.
Alrighty. Another question here about frequent urination is, what is the best treatment for stress incontinence and bladder neck constriction?
So so bladder neck contracture, what was typed?
Yeah, I guess this is more of an incontinence question, but they're asking about, treatments for stress incontinence and bladder neck constriction is what I see here.
Okay, so it sounds like that person is talking about post-prostatectomy incontinence with a bladder neck contracture. Stress urinary incontinence is not a typical symptom of BPH. So if you have coughing, laughing, sneezing induced incontinence with BPH, it means that you're not emptying your bladder hardly at all, and any kind of abdominal pressure is causing you to leak urine out of your bladder. Bladder neck contractures are not something we see in BPH. Bladder neck contractures are something that happens after the surgical treatment of prostate cancer, where the connection point between the urethra and the prostate has narrowed to like a pinpoint opening. And then opening that stricture will result in the ability to empty the bladder, but also increase the coughing, laughing, sneezing, stress incontinence. And that goes back into a talk on post-prostatectomy or cancer survivability, slings and artificial urinary sphincters that really aren't covered in this talk.
Certainly. Alrighty. Gonna refocus the question a little bit. We got some questions here about people that are wondering if they happen to have a resume treatment done and found that their symptoms are not the way they had wished. What can be done for them?
Well, the first thing I would say is how long has it been? So, and what symptoms are not better yet? So the obstructive symptoms are usually better by the third month. And that's the slow stream, hesitancy, feeling like they need to push or strain, not emptying completely. The irritative symptoms, the urgency, frequency, and getting up at night to urinate can take up to 6 months to get better. Right? If you were in full-blown retention and had a catheter and then had a resume, you might be now urinating without the catheter, but not be urinating like you were when you were 20. So what can be done? I talked to your urologist about your symptoms, look at the timing, and see if time is your friend and more time would help. Sometimes people who have had a resume will maintain their medications because the resume helped, but their symptoms were pretty severe before they got to that point. And not everybody is getting their treatment done when their disease is in the early state. Sometimes it's in the later state. And if the bladder has already begun to decompensate, there may be only so much we can do to help. Certainly keeping things from getting worse, but maybe not making them as good as could be. So for some folks, a second to resume is done. For some folks, an additional TERP is done. For some folks, the resume helped, but their bladder was really super irritated beforehand, and they're on a different type of medication to help with urgency frequency. They might be considering Botox injections or a pacemaker interstim type device for the bladder as well. And so it's really a factor of time and a conversation with your urologist on where you are in that pathway.
Alrighty, that is actually going to bring us right up to the end of our questions for tonight. We hope you found it informative and you'll join us again in the future. If you'd like to learn more about BPH, you do have a few options. There are more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. you'd like to compare any of the treatment options we covered during tonight's event, you can do this by going to menmd.com, navigating to the BPH condition page, scrolling down to the treatment section, and selecting up to 3 treatment options to compare. You can also call MenMD at 857-233-5837 or log into the password-protected secure MenMD portal to schedule an appointment with a MenMD personal health assistant or to follow up with any other questions you may have about tonight's event. To learn more about the green light laser or Rezum treatment options you saw mentioned tonight, please visit rezum.com. That is REZUM.com.